Okay, it is 9:10. We're going to call this meeting to order, certify that we do have a quorum. All 5 members are present. Item number 2 is discussion regarding Governor Abbott's open Texas orders. I think as everybody's aware, on Monday afternoon, Governor Abbott put out actually 3 executive orders, but the main one that applies to what's pertinent today is GA 18. It's a order to start the process to reopen Texas. His current executive order expires on Thursday, tomorrow, and so this order would take effect the following day, which would be May 1st. The main thing what that order does is it allows businesses, most businesses, not all businesses, but many businesses to reopen to capacity of 25%. However, 25% of the occupancy. However, there's also a provision in there that allows rural counties that have less than, have 5 or less active cases, and I did confirm it is active cases, to open to an occupancy level of 50% for those businesses in that county, and that is at the county's discretion on whether to do 25 or 50 if they fall into that category. There's some other provisions that have to be met as far as you have to have a testing center and you've got to have some other things accomplished, which we do. There are some businesses that still remain closed. Those businesses are hair salons, nail salons, gyms, personal care facilities, bars, things of that nature are still remaining closed. Barbershops. At this time, anything to do with cosmetology is still closed at this time, and that's by governor order. That is, as much as we would maybe want to do something different at the local level, that is a governor's directive order, and we do not have the ability to circumvent that order or to decide otherwise.
Can I ask a question?
Yes.
So I didn't get to see all of it. I listened to some of it on the radio. And so we opened up the movie theaters. I assume you watched it.
Yes.
But they won't open up a barber shop. Do they give any kind of reason as to why?
I think my understanding is that it's the personal contact part of it. They are still working on guidance on how to do the personal contact. When you go to anything else, it's less of a personal contact for an extended period of time, such as when you're getting your hair cut.
So you go to a movie theater, and I think it's great they open the movie theaters. I'm not against that, but and you go to a barber shop that's following all the strict guidelines of keeping the place clean, and they let one person in at a time. In a movie theater, I've never seen them clean one out in between movies. And I just find that interesting. Is there a better lobbying group for the movie theaters that may make more donations to political people than
Hollywood? The thing about the movie theaters is there's no new movies to release.
I know.
I agree with you. I understand the rationale to it, but the logic to it.
No, there's no common sense involved. It was kind of like they told us at the beginning, don't wear a face mask. Face mask, no, they don't do you any good, don't do you any good. They need to, when they want to do this stuff, they just need to come out and tell the truth. We don't want you to wear face masks at first because there's not enough to go around. We need them for the doctors and nurses. Now they're complaining that people don't want to wear face masks. Well, they spent 6 weeks telling them that it didn't do them any good. So this whole thing is more, at times, seems to be too much political and not enough common sense. They don't give a good reason other than just person-to-person contact.
That's, I believe that's the reason. What still remains closed is bars, gyms, public swimming pools, interactive amusement venues such as bowling alleys and video arcades, massage establishments, tattoo studios, piercing studios, and cosmetology venues.
Well, every barber shop and hair place, I always thought was about as cleaner than a lot of things. Those are a lot of mom and pop shops, so
yeah.
Everybody call the governor's office and tell him you want to get a haircut.
And I think that's a good thing to encourage people to do, is to reach out to the governor's office and let them know that it can be done in a responsible way, because there is ways to do it.
I've had a couple of hairdressers, for lack of better terms. I know they call them more fancy names than that. send me some information, and I did forward it on to the governor's office. Didn't do any good, but I sure did forward it on about how they keep their place clean and how they would let one person in at a time and make everybody wear a mask where they could, and I just, anyway, that's a little pet peeve that I have. I just have I don't know, that just gives me a burr under my saddle for some reason. You've got mom and pop shops trying to make a living, and we're going to open a movie theaters.
Well, I understand the gym thing in the larger cities.
Yeah.
Our small gym around here, they kept it clean, it'd be safer.
Yeah.
Yeah, you can go to Walmart, yeah, I agree.
I know that the gym owners here in town, they're also on Facebook, reaching out to the governor, email and stuff about, smaller gyms.
Yeah.
Local people's side. Currently, in Gainesville, 15,000.
Oh, wow.
She said 10, 15 more days. Also, they stopped their automatic.
Will you turn your mic on?
And I understand, the Home Depot, Atwoods, the grocery stores, that's all fine. I'm not against that. I'm not saying anything bad about any of that, but it goes against people's common sense when they can go to a store and there's a lot of people milling around. Of course, now we're going to be able to go to church, aren't we?
Yes.
Okay, they open the churches back up. That's good.
Yeah,
You couldn't go to
religious-
church and you can't get a haircut because they don't think it's safe, but you can pull into a parking lot of a big box store and there's so many cars in there, it looks like Black Friday. And I think that's where they lose some of their credibility, and that is where the angst comes from the public. Tell the governor they need to use some common sense. Anyway, I'll get off my
Bottom line,
soapbox.
it's not the Commissioners Court. It comes down from the governor's office.
Exactly.
That's correct. And I did reach out to the governor's office and let them know that I think there's safe ways to do, especially some of the barbershops and things like that. There's safe ways to do that. Did reach out to Representative Springer. I think he was in agreement on there is safe ways to do it. I think that there is the possibility that between now and May 18th, which is the potential for the next level, that there will be some guidance on that, but that is a directive from the governor's office that unfortunately we don't have any control over, but we can make sure that our voices get heard on our suggestions on it for sure.
So, yeah, I've been sending things on, so everybody needs to send things on.
What's ironic is we can't open barbershops up, and we can't keep residents from counties that are highly more infected than us from crossing the county line, coming here and doing business in our county. They come in, they can buy up all the toilet paper, they can buy up all the meat, and then go back to Dallas County. We don't have no control over that, but yet we can't use a barber shop.
Yeah, we can't get a haircut.
So,
So there is, along with his executive order GA-18, he did put out a 64-page report that is very comprehensive, and it does outline what various businesses need to be, precautions they need to be taken, and as well as individuals, what precautions they need to be taken. I think it's important that we note that this isn't the end of the story on as far as this virus is concerned. We're still going to be dealing with it for the foreseeable future. So people need to take precautions as things start opening back up, because it's those precautions that will help allow things to continue to open up more as we progress into summer. I think that's something important that we need to all be mindful of. There's a lot of guidance in that report. That report is on the governor's website. It's linked on our website as well. If you go to our homepage, I'm not going to obviously go through all 64 pages here, but there is a lot of good information for individuals, even religious institutions, things that have questions. There's some guidance in there on what they should be doing to help keep their patrons and staff and everybody else as safe as possible. I think one of the questions, and I wanted to have this in open court, but one of the questions that we need to have is, I know where I'm going to fall on it, but it looks like unless something changes in the next 24 hours, It looks like we'll meet the criteria to be able to open at 50%, because we will have 5 or fewer active cases. Right now, we have 3, so unless we get an additional 3 by tomorrow, which is possible, but if that does not happen, then there is an attestation thing that I have to send in saying we certify that we have less than this number of cases, and we wish to open up at, or wish to do the 50% marker. I would advocate for the 50%,
I would,
but I wanted to get everybody else's thoughts.
it is a serious disease. I'm not trying to, I want to make sure that someone doesn't think I'm trying to minimize this. I'm not. But life has to go on also, and so does business. And we can't keep people penned up forever. And the more you do, the more stressed out everybody gets. I believe since we can go to the 50%, we surely need to. I just want to make sure everybody understands, do everything you can do with the good hygiene so we can stay at 50%. That was one of the questions I had. So you're into this for 2 weeks, and all of a sudden you have an explosion of cases, then what? I don't think we will, but I'm just playing the what if.
And that's a good question. That was the first question that I had is if you're on that, if you're anywhere near, okay, what happens if you go to 7 cases? Do you go back and forth? And that doesn't happen if you're allowed to go to the 50%. If you do go to the 50%, there's 3 events that would trigger an automatic reversion to the 25. And the first one is 5 consecutive testing intervals with a positive rate of greater than 12%. So we're testing as a community. I know some of the doctors' offices are testing individually, but we're testing as a community 3 days a week. And so if you've got 5 of those, so basically a week and a half with an infection rate of greater than 12%. So we test anywhere between, I think we're averaging 10, 15 tests maybe. It varies. It can vary 4 to 6, and then so if we're testing 10 to 12 people each day, so over each, you would have to have greater than 12%. So you'd be 2 or 3 positive tests each time coming in for a period of a week and a half, which we haven't seen. But that is one of the triggers. The other trigger is 3 positive tests per 1,000 residents. So Cooke County has approximately 40,000 people, so we'd have to see approximately 120 active cases. You'd probably hit that first trigger before you'd hit the second trigger.
Yep.
The next one is a hospital capacity, surge capacity of less than 15%. Right now, both of our hospitals don't have any issues with capacity. We did run it by the possibility of opening to 50% by them, and in the other cities, didn't get any negative feedback on going to the 50%. They have the capacity to do it. Right now, they don't have any capacity. If anything, they're slightly under what their normal capacity is. So there's not any issues on that front. So the first one would be the trigger that would probably be most likely, but you're looking at 2 to 3 positive tests each day for a period of a week and a half.
You need a motion?
Well, that was
Talk more.
I kind of got this divided up and we can pull that above executive because we need to talk about internal, how we want to handle it, some internal issues, or not issues, but matters as far as making sure our employees are safe if we want to start opening up the courthouse. But item 4 is action on the public health emergency, which is where we can take action on authorizing going to 50%, and then we probably need to come out with a new declaration that mirrors the governor's new declaration, which I did draft this morning. All it does is change the number. Before it just said follow his GA 14 or 16 or whatever number that was. So I just said follow GA 18, which is the one that
The latest?
the latest. That is the only change to that document. I've got a copy of it somewhere in here.
I'll make a motion, we approve the 50%.
Second.
We got a motion by Commissioner Leon Clement, second by Commissioner Hollowell. let's vote on that, and then we can talk about the declaration after we come out of executive.
So,
Any further?
yeah, I'm going to hammer it a little bit more. So finally, we're getting to open some things back up. 50%, we're lucky. And the only reason is because apparently y'all have been very careful, you all being the public. So please continue to be careful. And I think everybody behaves pretty well in Cooke County. I think that's why we're doing as well as we are. So keep up the good work, and hopefully we'll get out of this in another month. That's all.
I completely agree.
Mirror that.
So we'll go ahead and vote on this. This is part of item 4, but we may have multiple action items on that for the minutes concerned. We can take action on the actual declaration unless y'all want to do that as well now.
We go ahead and we approve this, and we, for some strange reason, we end up with these couple of cases in the next 2 days.
Reconvene.
So here's what my understanding of it is. So by April 30th, you've got to be under 6. So, and that's tomorrow. So if something happens between now and tomorrow morning, you're looking at less than a 24-hour period that you would have to double the number of cases, which we may have some tests coming back from Monday. But if that doesn't, if we do get 3 or 4, we'd have to get 3 more active cases or more. If that does happen, then we're stuck at the 25. But assuming that doesn't, I'm assuming that's what you meant by the
That's
motion.
what I meant by the motion, because we just discussed that.
Yeah.
I asked the question, if
Yeah.
we get over the top on the cases, what happens?
So I don't know if that needs to be-
We go back to the 25%.
I don't know if that needs to be clarified or not, but assuming we don't get 3 positive cases between now and, it says April 30th, so essentially first thing tomorrow, I can sign that attestation and send it off.
I'm just concerned about communicating to the public. I mean, do you communicate?
Well, I think
it now, or do you-
So if you want to change the motion, I'll change the motion, but we just had the discussion, that's what would happen.
I think the communication is, unless something changes by tomorrow morning, we are going to 50% effective May 1st.
All right, I make that motion.
So that is the motion by Commissioner Leon Clement. I'm assuming that's your second still on that. So just for clarification, unless something changes within the next less than 24 hours,
That gets back into the common sense thing.
and we'll, if something happens, we'll do our best to make that known to everybody. But and as was pointed out before, there are some triggers that would require us to go back down to 25. So everybody needs to make sure to be doing, still practicing proper social distancing, proper hygiene. This isn't just all the restrictions are loosened. This is a step in the right direction, and we need to be taking this all together.
A little different situation though now that we're YouTubing it and people are hearing, hey, 50%.
Yeah, that's very, yeah.
On the first, it's
Yeah.
different than what we're accustomed to.
Yeah.
So those folks that have heard it today are going to assume 50%. If it changes tomorrow,
We need
I don't
to-
know how to best communicate it to them.
We're going to have another
We're
court.
going to have another court.
Yeah, and we'll have to just basically we could have another court and push that out even more. We'll do everything in our power if it happens between now and tomorrow morning.
I'm gonna stay on the optimistic side.
Oh,
too.
absolutely. I mean, the odds are, how many do we test Monday?
We tested 7 or 8, so we'd have to have,
A huge percentage.
and we've
of
got
those.
3 active now, so you'd be doubling your active cases based on, basically a 40% return. We do have a motion and a second. If there's no other discussion, all those in favor signify by saying aye.
Aye.
Any opposed? Ayes have it, motion passes 5-0. Item number 3 is executive session in compliance with Texas Open Meetings Act 551 of the Government Code. It is 9:29, and we will convene into executive session. good to go. It is 10:35. We are back in regular session. Item number 4 is deliberate and consider possible action regarding public health emergency declaration for COVID-19. In light of the governor's recent executive order, GA 18, which modifies which was issued on the 27th. I would suggest we modify our public health emergency declaration to indicate that that order needs to be followed instead of the previous order that was issued back in March.
Judge, is this one you want signed?
Yes. Unless anybody's got any questions on that order. This just says that that order needs to be followed instead of the previous order.
I'll make a motion to approve.
We got a motion by Commissioner Snuggs. Second by Commissioner Hollowell. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Any opposed? Ayes have it. Motion passes 5-0. Item number 5 is deliberate and consider possible action on personnel matters. I think this is probably the best time to talk about what we plan to do in light of the governor's recent report or order from the 27th. We are opening up a lot of the businesses stuff we are able to open up on May 1st to expand to up to 50% occupancy. We are making preparations to open most county facilities up more to the public, not necessarily complete capacity or complete completely without restrictions, but more to the public on May 18th, so approximately 2.5 weeks from today. That gives each department the ability to make necessary adjustments to ensure additional public safety for employees, and it gives us the ability to also make some modifications that need to happen in some of those departments to ensure safety of all involved. So we're going to be asking our department heads and elected officials to come up with any policies and guidelines they need for their individual departments. So at least for the time being, we're still going to be restricted by appointment only to county facilities. And then to what extent that happens on the 18th, we're still in working some of that out. But it will be happening on May 18th, unless anybody else has got anything else on that. Commissioner, you want to?
I would make the motion that we modify the current telecommuting policy, allowing it to expire on May 18th, with the exception of those folks covered by either FMLA or a doctor's directive.
Second.
We got a motion by Commissioner Hollowell, seconded by Commissioner Leon Clement. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Any opposed? Ayes have it. Motion passes 5-0. Item number 6 is to deliberate and consider possible action regarding security devices. As I alluded to earlier, we got some enhancements that need to happen from the security standpoint as we go forward, and some of that is what we plan to do over the next couple of weeks. So I will make
What?
pulling that
Well,
away.
somebody needs to cut that cable tie, then that would move.
So I will make the motion that we improve, that we make security enhancements in the amount of, I think this comes to, I'm going to round up slightly, $13,500 for various offices.
We need to do a budget amendment. Can we do that in an emergency situation, Shelley?
Yeah, we're just under disaster.
So we can,
We can do it, and then it'll,
and the
yeah,
necessary budget amendment would be
Yeah.
your motion, right?
and any necessary budget amendment to make that happen. Yes, that will be my motion.
I'll second that motion.
We got a segment by Commissioner Snuggs.
Is there a reason why we can't publicly say what that?
I think
I
it's,
think we can, can't we?
we can if we want to.
Well, it sounds all clandestine when we do all this.
Yeah, I
You
mean,
know,
it's not a
this isn't a,
true security.
Well, yeah, there's certain security that obviously.
but anyway, we're putting in plexiglass sneeze
It's
guards.
it's real glass.
Oh, real glass, I'm sorry. In other words, these nice little shields like you see in doctor's offices where you have a glass to protect the workers since so many people come in and out of here, to protect all our clerks and workers, and it's good for the people too.
And it is,
Get reimbursed.
and we should be able to get reimbursed a
Yes.
lot,
It's a good health,
75%, if not more.
it's a good health and safety item to include in our business offices where we interact with the public so much. You see them in all the doctor's offices and everywhere, and
But to add to that just a little bit, it is anticipated these will be permanent structures, so this will
Yes.
be going forward, and we're wanting to make sure to do it right. There is some safety to some of that as well, but it's health and safety reasons.
And it was determined part of them be framed in wood by our local maintenance.
Yeah, yeah,
And
and
the
then-
rest will be in aluminum. And we're going to incorporate the holes to allow folks to speak through them.
Yeah, we're trying to make them as accommodating as possible for individuals.
they will be an attractive safety addition for the public and for the workers of the courthouse.
Oh, that sounded good.
There you
Telling
go. We do have a motion and a second. Any further discussion? If not, all those in favor signify by saying aye.
Aye.
Any opposed? Ayes have it, motion passes 5-0. I think the last item is future agenda items. We'll have another court on Monday. We'll talk about carpet squares there.
Carpet squares and CTIF and.
Yeah. CTIF's on there, carpet squares,
And,
Carpet square.
cybersecurity.
and cybersecurity.
Security training, yes.
And the only thing we're concerned about there is whether or not everybody's gotten it.
Yeah, we just make sure we're in compliance or getting in compliance.
We need to go off.
Sooner or later.
Do our homework, make sure our people.
I sent you a review of this money.
Just now? Okay. Okay, I hadn't looked at that.
I make a motion, we adjourn.
We have to accept for our fund. So that means we have.
Okay. We have a motion by Commissioner Leon Clement, seconded by Commissioner John Clement. All those in favor signify by saying aye.
Aye.
Any opposed? Ayes have it, motion passes 5-0.
Are we turned off?